So good morning, everyone. I am Mariana Cassandra Perbilio, one of the organization's executive board members, and I will be your moderator for today's educational day. So for the second time this year, we are gathered for the annual Filipino Nurses Association of Quebec's Educational Day. Our today's topic is very interesting and timely, as everyone is affected by this situation. So for the past 2 years have been a big change for everyone, I believe, due to the coronavirus disease 2019 or COVID-19. It had changed our daily lives in many aspects, and unfortunately, many lives were also lost. In Quebec alone, there are more than 400,000 people who were diagnosed with this respiratory disease. For the people in the healthcare field like us here in today's event, it is a very tough everyday scenario, either when you're wearing your full PPEs the entire shift, or maybe when you're at bedside with your patient in his or her last breaths. So respecting public health protocols, vaccination programs, together with everyone's cooperation and effort, the battle towards the better side of this current situation is now foreseeable. In line with the current COVID-19 global pandemic, our topic for today's educational day is entitled COVID-19 Awareness. As an expert in dealing with infectious diseases, we will be joined shortly by our guest speaker. So as a brief reminder to everyone again, I would like to kindly ask our participants to put their microphones in mute once again. Thank you. To formally start this event, may we call on the FNAQ President, Ms. Mary Grace Ocampo, for our opening remarks. And one of our Directors of Continuing Education, Ms. Aiza Alam, will then introduce our guest speaker for today's educational day. Ms. Ocampo.
Good morning, everyone. It's a pleasure it's nice to see you all to attend our second educational day. Thank you for joining us. And thank you to our guest speaker, who's one of my colleague at the Montreal Neurological Hospital. Thank you for accommodating us today. And I'll pass you to Aiza Alam, one of our Director of Education.
Okay, good morning, everyone. My name is Aiza Alam, one of the organization's executive director, and welcome to our second annual educational day for the term 2020-2022. It is my great pleasure to introduce to all of you our speaker for today's event. He obtained Diploma of College Studies at Vanya College in Health Science, major in Biomedical Science in 2009, and completed his bachelor's degree in nursing at McGill University in 2012. In the following year, he completed or obtained his license from the Ordre des Infirmières et Infirmiers du Québec, and he worked as a nurse clinician at the Montreal General Hospital in the intensive care unit for 3 years, then transferred to the Montreal Children's Hospital in the pediatric intensive care unit for 5 years. He was also a nurse educator at the Royal Victoria Hospital and Montreal General Hospital in COVID-19 vaccination clinic. And presently, he is working as a nurse consultant at the Montreal Neurological Hospital in the Infection Prevention and Control Department. So today he is going to share to all of us his expertise, especially the most recent changes and practices of COVID-19. So without further ado, please join us in welcoming our speaker, Mr. John Aldrin Magtibay. Morning, John.
Morning, everyone. Thank you so much for inviting me to present today. Thank you for the opportunity to be able to share knowledge about COVID-19. And I think, especially while we're in this pandemic, I think, knowledge is very important because it's going to allow us to make better decisions in our everyday living. And so let me just share my screen for you today. Okay. Are you guys able to see my screen properly?
Yes.
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 All right. So today I'm going to be talking about an overview of what's happening right now regarding COVID-19 pandemic. My objectives for today is for us to have a better understanding of COVID-19 and how to protect ourselves and others. And as I said, knowledge is power. And once we know more about something and once we understand better about something, then it's easier for us to make better decisions. And secondly, the objective of this presentation today is for us to gain perspective on what's happening right now in Quebec. So before I start, I just want to give a little basic review of what a virus is. So a virus is a very tiny germ that can only thrive and reproduce in a host, which is a living organism. So that can be a human, an animal, or a plant. And some viruses cause disease. So not all viruses cause disease, but some do. If you look at the picture here, you have HIV, hepatitis B, Ebola virus, and so forth. And each virus may also affect one organism differently from another. So for example, a virus that can cause illness to an animal, like a cat, for example, may not necessarily do any harm for us humans. And one thing to note, importantly, is that it's different from bacteria, and so it cannot be treated with antibiotics. A virus contains several parts. The most important part of a virus is the genome, so your DNA or the RNA. And basically what it is, it's a blueprint for instruction on how to make copies of itself. It's protected or enveloped by a capsid protein shell. And then on the outside, you see those little spikes. So those are called receptors, which then helps the virus goes into the cells. So how does the virus work? So first, when we get them into our body, we have our portal of entry. So like, for example, our eyes, our nose, our mouth for respiratory viruses. Once they get inside us, they try to get inside the cell. So they trick it using their receptors. And then once they're inside, they release their DNA or their RNA. And so they force the cells to make more copies of the virus. So they take over the cell, they hijack it, and then new viruses are released, and then they go to the other cells and they repeat the process. So we get sick when the virus has established infection in many cells and when our body's normal functioning changes. Now, COVID-19 is a respiratory disease caused by the SARS-CoV-2 virus. So this virus has been discovered in 2019, and it's a coronavirus. So it gets its name from the structure of it. So if you look at the spikes, it looks like a crown. So in Latin, crown is corona, and that's how they named it. And coronaviruses are a large family of viruses that usually cause mild to moderate upper respiratory tract illness, like the common cold, for example. And there are hundreds of coronaviruses, and a lot of them are present in animals. But there are some times when viruses from animals cross over to humans. And there are 3 known coronaviruses that have caused a lot of problems for humans. So first you have the SARS-CoV in 2002. So what we usually referred to as SARS back then. And then you had in 2012 MERS-CoV, so the Middle East Respiratory Syndrome in 2012. And now, as we all know, and we're living in the SARS-CoV-2, which causes the disease COVID-19. And worldwide, it has affected 257 million people. So you can see that it's very problematic. That's why they declared it as a pandemic. And unfortunately, 5 million people have died from this disease. In Quebec itself, as of November 23rd, there's about 400,000 of people affected and 11,000 have died. And when we look at the evolution of COVID-19 in our province, we can see that we've had several waves. And we see that now we're again in another wave of pandemic. And if we break down the cases according to age, we can see that in wave 1, it's affecting morely the adult population. You can see like 0 to 9 years old, there's only about 3% that were affected. But now in wave 4, we see that it affects more the younger population. And why is that? It's because the elderly population or the older adult population, a big percentage of them, or if not all, are vaccinated, whereas the younger population have not yet reached a good vaccination rate. And until recently, only 12 years old and above are allowed to get vaccinated. And so this is why it shows how more of the cases that we're seeing now are in the younger population. And the same thing with deaths. In wave 1, it's affecting more the elderly. And this is why, and this is the reason why, you know, in terms of the vaccination, they were also the priority because it's affecting them more. But if we look now at wave 4, yes, it's still affecting the elderly, but you can see that the age of people dying are starting to become younger and younger. So definitely this is not just a problem of the older population anymore. In terms of hospitalization, it's the same picture. In wave 1, you have the older population who are more hospitalized. But now in wave 4, we're seeing younger and younger population being hospitalized. And if you see like the 0 to 9 years old, where before they present a very minimal percentage, now they're representing 3.3% of our current hospitalizations. Those requiring ICU is the same. Now, we've all heard about the COVID variants. And one of the reasons why we have these variants is because RNA viruses, so COVID-19 is the SARS-CoV-2 is an RNA virus. So RNA stands for ribonucleic acid. And basically, in their instructions, in their blueprint, they don't have a proofreading system built in. So when they make copies of themselves, they often make a lot of mistakes, which causes the mutation of the virus. So some mutations make the virus weaker, some make them stronger. And SARS-CoV-2 have hundreds of variants. You know, we just don't know all about them, or we don't hear about all of them because researchers only focus on variants of concern. You know, they ask, is this new variant more contagious? Is it more deadly? Do they affect the vaccine efficacy? And so right now, the variant that's more predominant, or what we mostly see in our cases nowadays, is the Delta variant. All right. So how is COVID transmitted? So how do you spread COVID-19? So first, COVID-19 is spread through droplets and aerosols. So aerosols are smaller droplets, and it's created when we talk, when we sing, when we shout, or when we cough and when we sneeze. So if you look at the picture, when you're coughing or you're sneezing, it creates that much droplets and aerosols. So this is one of the reasons why we do masks. We wear masks and why we social distance. The other way of spreading or contracting this disease is through infected hands. So if you touch your eyes, your nose, or your mouth after contact with an infected person or an infected surface, then that's how you get the disease as well. So this is why hand hygiene is very important. And a person who's infected with COVID-19, they can be contagious from up to 48 hours before their symptoms appear. And so if you look at this picture, the COVID-19, it's spread by droplets. And we do the social distancing up to 2 meters because when they did the studies, for someone who, when they cough or when they sneeze, the droplets can reach up to 2 meters. And because the droplets are bigger, once they're expulsed out of the person, they fall by gravity. Now, there's been talks, is COVID-19 airborne as well? So there are certain medical procedures that can make COVID-19 spread by airborne. And this is through AGMP, what we call. So AGMP stands for aerosol generating medical procedures. So in the hospital, when someone has like any supportive ventilatory system, so if they have like a mask, for example, that's like pushing air to help them breathe, then consequentially, they create these what we call small droplet nuclei. So in terms of size, the droplet is like bigger, and then the small droplet nuclei is very, very tiny. And when they're very, very tiny and in high concentration, they can be spread airborne. So they go further than 2 meters and they can stay suspended in the air longer. So that's why in the hospitals, we require healthcare workers to wear N95 masks, to wear a gown, and to have a negative pressure room to remove all the air and consequently all these small droplet nuclei from the environment. Now for us in like normal situations like at home or outside, we don't really need to wear an N95 mask because they would simply go by the droplet route. So outside or at home, someone coughs, it would fall by gravity up to 2 meters. Now, in terms of the Delta variant, we found out that it's more than 2 times as contagious compared to the previous variants, and the viral load is up to 4 times more elevated. So the viral load is how much the amount of virus in your body. So because it's 4 times more elevated, it means more viruses are being produced more rapidly, making it easier to spread. So with the Delta variant, it's more transmissible. And the incubation period, so the incubation period is the time from when you were exposed to when you start having symptoms. And the original variants, it's 1 to 14 days with a median. So median is the average, 5 to 6 days. So with the old variants, it can take you up to 5 to 6 days before you start showing symptoms. But in the Delta variants, you can be having the virus for longer amount of time, 18 days, and it can show up much sooner, 4 days, because it, the reproduction rate of this variant is much faster compared to the older ones. And in terms of the infectious period, as I said, 48 hours before you start having symptoms, or some people are asymptomatic, so we count from when you have the positive tests. And usually up to 10 days after you having the start of your symptoms or after your positive test, if you're asymptomatic, is when you're infectious. And usually beyond that, you start to become less infectious because the viral load, right, the amount of virus in your system lessens, because your body is fighting against it. And if you're vaccinated, then you fight the disease faster. But the infectious period, as I said, can be longer in Delta variant, but also for people who are immunocompromised. So that means people who have a weaker immune system, or their immune system is not working well. And those who are having severe symptoms that requires hospitalization and sometimes having ICU care. Now, what are the signs and symptoms of COVID-19? So even with the Delta variant, it all remains the same. So they're grouped in 3 categories. You have the general symptoms on the left. So you might have a headache, a major fatigue, a general muscle pain not related to physical exertion. You may have fever, a significant loss of appetite, sudden loss of sense of smell without nasal congestion, with or without loss of taste. And in terms of respiratory symptoms, you may have new or worsening cough, shortness of breath or difficulty breathing. You may have sore throat or runny nose. And we also have the gastrointestinal symptoms. So we might have nausea, vomiting, diarrhea, or stomach ache. Now, usually for any symptoms that we might have, for us to consider it's real, my way is usually to wait 24 hours. Because you know how sometimes you wake up in the morning and you have a sore throat and then you start thinking, oh, do I have COVID? But then if it disappears, then usually that's something that's transient, it's temporary. But if it's persistent the whole day, you're having a sore throat, then you should start wondering, okay, this might be COVID, and so I should get tested. And so COVID is diagnosed through testing, right? The golden standard for diagnosing COVID is a laboratory formed NAT. So NAT stands for Nucleic Acid Amplification Test. You might have also heard PCR or RT-PCR, reverse transcription polymerase chain reaction. And this is mainly collected through a nasopharyngeal swab. So they insert a swab from your nose going all the way to your throat. So this is the long swab. And this is the one that's most preferred because it has a high accuracy. It can collect a lot of viruses. And then they slowly introduced the other ones, the nasal swab, the saliva sample where you would spit on a container. And then you have a saliva mouth rinse and gargle where you would gargle with water and then you would spit into a container and then they test your saliva. Now, while these ones are less invasive and a little bit less uncomfortable, they're not as accurate compared to the nasopharyngeal swab, and they can miss about 10% of the positive cases. But overall, these type of sample collection under the umbrella of NAT is what is the gold standard for diagnosing COVID-19. Now, we've also developed rapid tests because the NAT and the AT in the laboratory, they can take hours before we get the result. So sometimes in people that are asymptomatic, it's hard to tell if they would have COVID-19 or not, and we have to wait a longer period. But now they develop rapid tests where results can be obtained usually in less than an hour, but the sensitivity is generally inferior compared to the standard laboratory test. So now in testing centers, they can also do NAT. They use the company ID now, and its reliability is also almost comparable to the standard laboratory test. And you also have the antigen rapid test that are used in point of care. So they may be used in schools, in workplaces, for example, where if you have an outbreak, an easy way for you to determine if you might have COVID or not is through the antigen test, because you can get the results within minutes for this one. But the only thing is, because it's not as accurate, the results need to be interpreted appropriately based on the situation. So usually, if you're coming from if you're exposed in an outbreak, let's say in a school or a workplace, they do an antigen test and you are positive, then we consider you positive. But then if you're negative, then they would need a second, they would need a second test to make sure. So you still need to do the PCR test to confirm if you have COVID-19 or not. And the testing accuracy overall also depends on when you get tested. So if you look from your initial exposure, day 0 to 2, if you get tested right away, 98% of the time, they won't detect the virus, because the virus has only been introduced into your system and it hasn't, the reproduction has not been a lot yet. So the amount of virus that you have in your system are still very low. So 98% of the time, they cannot detect it. The best days for getting tested once you were exposed from a positive case is between days 4 to 8, because by that time you would have a lot of virus in your systems already, and usually this is the time when you're going to start having symptoms. Okay, now a lot of the times we don't know when we're exposed to a positive case, right? Some of us might be taking the public transportation, or in our workplace, or we went to a restaurant. We don't know when those people will turn positive, and we don't get notified as well, because we don't know everyone. So a golden standard when to get tested is when you start having symptoms, as I said earlier. So once you start having symptoms and you know that it's persistent, then that's the time for you to get tested, because when you start having symptoms, it's when there's already a lot of virus in your system. And usually by day 15, the amount of virus in your system is already decreasing. So, and you may not be infectious to others, so they might not detect it at all. Now, let's talk about the COVID-19 vaccines. So COVID-19 vaccines are the best way to protect ourselves from COVID-19. So before I talk about it, we'll do a little review of how our immune system works and how the vaccines work. So usually when a pathogen, so the disease-causing organism, when they enter our body, it introduces an antigen. So remember, in the virus structure, you would have the receptors, those spikes. So those spikes are an antigen. And whenever they're introduced to our body, and our immune system recognizes that it's something that's foreign, then our body will build a specific antibody that will grab into this antigen, and then it will try to kill this pathogen. And each antibody is created specifically for each antigen. So the antigen for the Ebola virus, for example, you would create a specific antibody just for the Ebola antigen. And so once this antibody is produced, the body also produces antibody-producing memory cells, which remain even after the pathogen is defeated. And so when the next time that the same pathogen comes back, your antibody response is going to be much faster and more effective than the first time because of the memory cells. So your immune system remembers this pathogen, and it's going to be able to respond to it more quickly, protecting you against the disease. So if we look at it in the vaccine perspective, there are many different types of vaccine, but they all have the same purpose. So an example of what we call a live attenuated vaccine. So it's a weakened form of the virus, and it includes a part of the antigen. So instead of you being exposed to the virus, the vaccine will do the introduction for it. And so once it's injected into your body again will notice that it's foreign, and then will start building new antibodies for it. So then after that, you encounter the real virus, the real organism, then our body is already trained. It already knows how to kill this virus, how to defeat this virus. Now, in terms of the available COVID-19 vaccines in Quebec, we have 3. So we have the Pfizer, and now they have these new commercial names, Comirnaty. We have Moderna, which is now called Spikevax. And we have the AstraZeneca Covishield, which is the same vaccine. Now it's called Vaxzevria. So now they're much harder to pronounce. So the Pfizer and the Moderna vaccines, they are an mRNA type of vaccine. So mRNA stands for messenger RNA. So this type of vaccine contains instruction for making the SARS-CoV-2 antigen, and it teaches them to the cells. So after the antigen is made, the cells break down the instructions. So it breaks down the mRNA, so it doesn't stay in your system, and it gets rid of them. So the cells, your own cells, would then display their antigen on their surface. And then the same thing would happen. It would trigger your immune system to start developing antibodies. And from then on, your body is now equipped to fight SARS-CoV-2. And one important thing to note, because there's a lot of people who ask about this, does it alter our DNA? The answer is no, because the mRNA never enters the central part or the nucleus of the cell where the DNA is found. So they never have that interaction, and they won't have that opportunity to interact and alter and whatnot. And besides, once it's done its job, the mRNA, then it would be destroyed and your body will get rid of it. Now, the AstraZeneca Covishield vaccine, it's a viral vector type. So it uses a harmless virus to us humans as a delivery system. So this harmless virus, they would modify it to be able to encode the SARS-CoV-2 antigen, that receptor spike. And so once injected, it goes into our cells and it teaches them to make the SARS-CoV-2 antigen. And from then, it's the same thing. The cell would display the antigen on the surface. The immune system will recognize that it's foreign and start making antibodies for it. And again, after that, our body is now equipped to fight SARS-CoV-2. Now, if we look at the comparison of each vaccine, in terms of indication, so Pfizer, now they've just gotten the authorization from Health Canada to be able to vaccinate 5 years old and older. Moderna, they're still in the process of getting the authorization, but for now they're authorized for 12 years and older. And for the AstraZeneca, it's recommended for those who are 18 years and older. But just of note, here in Quebec, we have a preferential use of mRNA type of vaccine, so the Pfizer or Moderna, because it has less risk of side effects compared to the AstraZeneca or Covishield, and it has proven to have more efficacy against the COVID-19. And a lot of it has also, like different factors also influence why Quebec prefers the mRNA type of vaccine, is because of the availability as well, because we have more mRNA vaccines available for our province. Now, in terms of the number of doses, for Pfizer and Moderna, it requires 2 doses. Same thing for the AstraZeneca and Covishield. But for those who are immunosuppressed, so again, those who have a weak immune system or immune system that are not working, and if they're in dialysis, they would get 3 doses. And the reason for that is because their immune system is not working well. We want to give them as much chance as possible to be able to be exposed to the antigen and for their body to start making antibodies as well, because the studies that they have done, sometimes people who are immunosuppressed does not make any antibodies or at all, or the antibodies are very, very low. So that's why when they did their studies, for them to be adequately protected, they would require 3 doses for now. And for those who are immunocompetent, so meaning their immune system are working well, and they've had COVID-19 confirmed by NAT, then they would only require 1 dose. And the reason for that is because the illness itself is considered as like the primary, because it's the illness who would introduce the antigen to your body, but then and then the vaccine would serve as like the booster shot. They require a booster shot for those who have had COVID-19, because it really depends on each individual who've gotten COVID-19, because some might have had a lot of the virus, and so the body's made a lot of antibodies. Some might have had a lower amount of virus, and so therefore they might have made a smaller amount of virus. So the reason why they want them to have a vaccine as well is because to have that standardized amount of antigen, so that the amount of protection that the antibodies are made would be comparable to those who would have 2 doses of vaccine. Yeah. In terms of the interval, the recommended is 8 weeks or more, and the minimal is 21 days. So I know early on in the vaccination campaign, there's been a lot of talks about it, like, oh, how come in the US they're following the manufacturer's recommendation, which is 21 days, and how come in Canada, in the beginning, we were doing 16 weeks even. And one of the reasons for that, and I think Canada and Quebec have made a really good decision, is because they want the majority of the population to be at least exposed to it with a vaccine. And also, with knowledge from previous vaccines, the longer the interval is usually between the doses, the higher the antibody level would be after the series would be completed. So that would mean that you would have a longer duration of protection against the disease. And so now they recommended that an 8 weeks interval is a good amount of time between interval doses to be able to have a higher antibody level after we complete the series. Now, for those who are, again, immunosuppressed and dialyzed, they have a different schedule because, again, we want to give them the chance to be able to create more antibodies in a faster time so that they'll be protected faster. And then in terms of efficacy, in terms of efficacy, now that they've started vaccinating the 5 to 11 years old, the efficacy is actually very, very good. And this is against the Delta variant. So for the 5 to 11 years old, they would be protected 91% of the time against COVID-19, 7 days after the second dose. For the 12 to 15 years old, it is 100%. And for those who are 16 years old and older, it would be 85% against symptomatic infection and 75 to 97% against hospitalizations. So although the efficacy has decreased a little bit for the Delta variant, it's still a very good efficacy against the COVID-19, because if we compare it to other vaccines, actually, like if you look at the flu vaccine, their efficacy is only 40 to 60%. For the pneumococcal virus, the pneumococcal vaccine is only about 70% effective. So the numbers that we have for our current vaccines still perform very, very well against the Delta variant. Now, if we compare it to the AstraZeneca and Covishield, you can see that against COVID-19, it's much weaker, 67%, but again, that still represents a very good number. Now, while looking at the efficacy, it's very important to realize that, it's not 100%. So when you receive the vaccine, it's important to realize that you're not like fully immune. You're not, sorry, I won't use that word, fully immune. You're not like a superhuman that won't get the vaccine at all. And we see that especially now with the Delta variant, where those who are fully vaccinated, so they receive 2 doses, they're also starting to get infected with the Delta variant. Now there's talks about booster shots. And again, in Quebec and in Canada, we would prioritize the use of Pfizer and Moderna. So they're right now, again, because of the current situation, they're mostly indicated for those who live in long-term care facilities and for those who are 70 years old and older. Now, research now is saying that after 6 months of your vaccine series, your antibody levels starts going down. But again, to reassure people, even though it has dropped, the amount is still very good to consider us protected from developing severe symptoms of COVID-19 or developing or requiring hospital care or ICU care, and even from dying from it. But right now, what's happening is we're seeing the elderly, the rate of infection in the elderly is starting to rise again, and because they're very likely to develop severe complications if they have COVID-19, they want to prioritize them in terms of getting the booster shot. So when do they get the booster shot? It would be for the long-term care residents, it would be 5 months after their last dose. But for us, when they're going to start to be opening it to the general population, it would be the same. It would be around 6 months. Now, what are the side effects? So this is something that concerns a lot of people, and I think it's important. It's valid to recognize that it is concerning, because you want to make sure that you know what you're putting in your body. You want to make sure that you're not going to get sick from it. But one thing to remember is that would you rather be sick from the disease, which can have many unpredictable complications, or the vaccine where it's been studied rigorously, it's been monitored a lot, and so and the side effects are very minimal, then I think you have a better chance with the vaccine. So with the mRNA type of vaccines, so with the Pfizer or Moderna, a lot of the times people would just have pain in the injection site. Less than 50% would develop headache, fatigue, fever or shivering, joint pain, muscle soreness, diarrhea or vomiting, swollen armpit lymph nodes. And again, these reactions are very temporary. Less than 10% would have redness or swelling at the injection site. Less than 1 person in 1,000 would have facial swelling. And this was a major concern for the teenagers. Less than 1 person in 10,000 may develop myocarditis or pericarditis. Now, for a regular person who would hear this, they're gonna act like, oh my gosh, I can get myocarditis from the vaccination. Well, just to let you know, for those who did develop myocarditis or pericarditis, and myocarditis is inflammation of the heart, and pericarditis is inflammation of the lining of the heart. So again, big words, but once you look into it and understand it better, it's like, oh, okay, it's not that bad. But people don't know that COVID-19 itself causes you to have myocarditis. And again, it can cause you to have many severe complications. And for those who did develop myocarditis or pericarditis after being vaccinated, a lot of their cases, the majority, if not all, were very mild, and they were very easily diagnosed, and they were treated very well. I was speaking to an infectious disease specialist at my hospital, and he says the majority of them only requires even just Advil, the Advil that we take over the counter, and it's really just that. Then you would have approximately 2 persons in 100,000 who can have a severe allergic reaction to this vaccine. But again, during this time, people who develop severe allergic reactions or are known to have allergic reactions to the ingredients of the vaccine, they would be referred to an allergy specialist who would then have like their own protocol of introducing the vaccine to these individuals. Now, if we look at the side effects for the younger population, so for those who are 5 to 11 and even 12 to 17, a lot of them would experience redness at the injection site, some headaches, some fatigue, some muscle soreness, and also some shivering, some fever, some diarrhea or vomiting or joint pain. Now, when I mention these side effects, it doesn't mean that you're going to experience all of them, right? Very minimal amount of people do experience these side effects, and they only usually last for 1 or 2 days, and at most sometimes a week. And a good thing in the studies that were done for the children age 5 to 11, they haven't seen any cases, but they cannot exclude it completely. But they say that there's a very small risk of them developing it. And again, because of what we know right now, it's very easy to be diagnosed and it's very easy to treat. So at the end of it, are they safe, right? The short answer is yes. Our Health Canada, they do a lot of review of the vaccines. They pay attention to the safety and effectiveness, and they go through the same standards when they test the vaccines, because a lot of the concerns is, oh, this vaccine has been developed very fast. We don't know the long-term side effects of it. Now, they go through the same process. For those who are concerned about the long-term side effects, through history of vaccines, the majority of the side effects, you would see them like immediately or close to the vaccination date. Like you won't see like 10 years down the line, you would develop some severe complications, because that might not even be related to the vaccines at all. But just to say that they monitor the vaccines very, very closely, and they have a system where they report any unusual reactions after the vaccines have been given to people. So again, any concerns or hesitations are valid, but it's important for us to get the correct information. Ask a healthcare professional, and don't just flat out reject the vaccines. Now in Quebec, we're one of the leading places in the world that has the highest vaccination rates. So 80% of our population has at least received one dose. Those who are eligible, the 12 years old and up, they haven't included the numbers for the 5 years old to 11 here, but at least those who are eligible to get the vaccine, 91% of them have gotten the first dose. And now 89% have at least received 2 doses. So these numbers are very, very good. And these were the numbers that I've taken from the Institute of Public Health of Quebec just yesterday. Now, again, when we look at the Delta variant and how it affects the COVID-19 vaccine, many studies were made. And so unvaccinated people are still much more at risk of getting hospitalized and of dying. Now, if you look at these graphs, the green one is the fully vaccinated, and the blue one are those who are unvaccinated, and the red one are those who are partially vaccinated. So you see that the number of positive cases remains very, very low for those who are fully vaccinated, but very high for those who are unvaccinated. And the same thing we see for those who are hospitalized. Very minimal amount of fully vaccinated people are getting hospitalized when they get COVID-19, but a large number of people still will require hospitalization if they're unvaccinated. What else do we know? Unvaccinated people are also much more likely to get infected, and therefore they have a greater risk of transmission to others. So they have a higher risk of spreading the disease to others. Fully vaccinated people can also get COVID-19, so what we call as a breakthrough infection, but it's much less compared to unvaccinated people, as we've seen in the previous graph. And then fully vaccinated people with symptomatic breakthrough infections can transmit the virus to others, but because of the our body who is trained to fight the virus, the fully vaccinated people would spread the virus for a shorter time because the virus is killed faster. Now to conclude, I think it's very important that we understand what the virus is. We understand how we protect ourselves from it, because again, it can influence us to make better decisions. So I know that a lot of the time we get our information from people we trust, but we have to make sure that the information we're receiving is also credible, meaning a source that we can trust. So one way of protecting ourselves and others against COVID-19 is getting trusted information. So not just something that we see from Facebook or from TikTok, because I remember, especially in the beginning of the vaccine, at the beginning of the pandemic, where we didn't know much about the virus, there were a lot of things circulating on Facebook where, oh, well, if you drink hot water, it's gonna kill the virus, or if you drink garlic tea, then it's gonna kill the virus. But now we know that those are not the case. The best way for us to protect ourselves and others against COVID-19 is to get vaccinated. Again, even though now that it seems like restrictions are loosening, we're able to travel again and see each other again and assemble together. We have to remain vigilant. The pandemic is not over, but so we need to make sure that we're still vigilant. So in terms of wearing masks, we all know that, and now that we know how COVID is transmitted, it's much more. We're gonna think more. Okay, well, it's important to wear a mask properly. You would have your nose covered, you would have your mouth covered, so that the chances of you passing it to others, if ever you get it, is much lower. And even for you, if ever someone coughs in front of you, they're wearing a mask, you're wearing a mask, then the risk is even much lower. Social distancing. Now we know that droplets can go up to 2 meters. So if we're if we're with other people, then we should be maintaining at least 2 meters of distance, especially if we're not wearing masks, right? Hand hygiene, again, the same thing since the beginning. We know that the virus can be spread by touching the infected person or an infected surface, and we touch ourselves and we can get the virus. So very important that we do proper hand hygiene. So that means if you're doing hand washing with soap and water, you would really do all the corners of your hands, because there's a lot of places in your hands that are missed actually. So pay attention on where you're washing, and make sure that you're rubbing at least 15 to 30 seconds. Now for hand sanitizers, usually you should put a good amount, and you should be rubbing at least 15 seconds or until the the alcohol gets evaporated. So I hope that today's presentation was a good reminder for us, that I hope you've learned something new from this, and for you not to keep this information for yourself. Share this information to others, because again, knowledge is power. The more people know about this, the more people understand about this, then the better it is. The better it is for everyone to make better decisions for themselves and for others. So with that, thank you very much for listening to me.
Thank you, John. So if you have questions, kindly put it in our chat box, or you can voice it out now with John.
So just for the open forum, so for the benefit of all the virtual participants, we have 2 ways of asking questions. So the first way to ask your questions is to virtually raise your hand. So that means if you're using your laptops or personal desktop computers, you can do this by clicking the icon labeled reactions at the bottom right part of your screens, and then click the raise hand button. Or if you're using your mobile phones or tablets, click either the three horizontal dots or the more option at the bottom right corner of your screens, and then you can tap a raise hand. Kindly wait for the moderator, yours truly, to acknowledge you, and you will be spotlighted thereafter to ask your questions personally to our guest speaker. And another option is to just simply type your questions on the chat box, which is accessible at the bottom part of your screens. Okay, so we will now start collecting questions from our virtual participants. And on the chat box, we have a question from Analu Carlon. So she asked, can healthy individual get a booster shot or third dose of vaccine, or is it solely for immunocompromised individuals?
Thank you for that question. So the short answer is yes, but not now. So the reason, again, as I mentioned earlier, the reason why the immunocompromised individuals were prioritized of getting the third dose is because their immune system is not working as well. So compared to us healthy individuals, where we can produce a good amount of antibodies protecting ourselves against the disease, those who are immunocompromised don't have that same capacity. And so by them getting the third dose earlier, we're giving them more chances for them to be protected. And actually, they were allowed to have the third dose since August. Yeah.
Thank you for that. And also our Director of Continuing Education, Isa Alam, will ask a question to you, Mr. Magtibay, sorry.
Jan, thank you for mentioning about the COVID-19 vaccines that doesn't alter our DNA, because many of the people I've talked to, that is one of the many reasons why they don't want to get vaccinated. So my question would be, because now it's flu seasons, what is your advice to the public about getting flu vaccines? Because some people believes that if you had the vaccines, the COVID vaccines, you don't need the flu vaccines for now.
So again, as I said earlier, the antibodies that we make in our body are specific for each antigen for a specific pathogen. So the antibodies that you make from getting the flu vaccine will be different from the antibodies that you will make for the COVID, from the COVID vaccine. So it's very important that, that you get yourself vaccinated for the flu. And if also you're wondering, like, why do we have to get the flu vaccine every year? Is because the flu vaccine mutates a lot. Like the mutation rate of the flu is much higher compared to other vaccines, other viruses. And so each year they actually take the three variants that are the most present in the world. And they would try to make a vaccine against those three variants. So giving us a better chance to be protected from it once the flu comes to our part of the world. So, and another reason why I recommend people to get the flu vaccine is because, you know, you especially now that it's flu season, it's so easy to get so many viruses. You know, you start having cold, you start having runny nose, coughing. You start wondering, okay, well, is this COVID now? Is this the flu? But once you've been vaccinated with the flu vaccine, then at least you know that you have a good chance of fighting the flu. And the same thing, if you're vaccinated with COVID, then you have a very good chance of fighting COVID.
Yeah, thank you.
Any more questions from our virtual participants?
How can I ask a question. You can hear me?
Yeah,
Yes,
we
yes.
can
Yes,
hear you, Tita.
Yeah. My question is that how come all these viruses, I think right now we have a new virus again coming in. And how come all these African people are the one bringing this virus? What components they have in their system there or in their body that they come and bring it here? So we have to protect ourselves again, because this is, and apparently this is very fast sickness again that is going now.
Thank you for bringing up that, Tita Al.
You're
So
welcome.
what we're seeing in the news right now is this new South Africa variant, right? So it's causing a lot of concerns to people because it's infecting a lot of people in South Africa. And so now you hear countries that are placing travel bans against South Africa and the other African countries that are also affected by it.
Yeah.
Now, again, we're going to go back to the concept of how virus mutates. So the viruses, because we'll stick to the coronavirus, the SARS-CoV-2. It's an RNA virus, so it doesn't have a good proofreading when giving instructions to cells when it's creating itself. So it makes a lot of errors. And so when they make those errors, that's when you get variants, right? Some variants are weak, some variants are strong. So in terms of the South African variant, they're actually still studying it because they don't know much about it. So the question, if this is going to be the new variant that's going to replace the Delta variant, we don't know yet. Okay. But one thing to remember is, us in developed countries, we're very fortunate to be able to have vaccines. And even now we're talking about the third dose, but many places around the world haven't even gotten a first vaccine, or their vaccination rates are very low. So what this means is the virus in those countries have a higher chance of reproducing itself, a higher chance of making mistakes and creating new variants. And so unless the whole world gets vaccinated, then we're going to continue seeing these variants from happening. And especially for places where they have a very low vaccination rate, then you're going to have much more new cases coming from there. So I think, developed countries should have a responsibility to share the vaccines. And because now, like, traveling is very open around the world, it's very easy for someone who, they're gonna think, you might think, okay, I'm fully vaccinated, I'm protected against COVID-19, but then you're gonna travel somewhere where there's a low vaccination rate and there's a high chance of you getting the vaccine, getting the COVID variant. So now, because you're vaccinated, you might not get sick from it. You might be asymptomatic, or you might just have a runny nose or very, very mild symptoms, but you bring it back to where you come from. And then that's when you infect others. We still have the kids that are not vaccinated, and then that's how it spreads. And this is how, the Delta variant and all the other variants were brought to Canada, is because of the traveling. But we need thank you. But we need to remember that, unless everyone has some sort of protection against the vaccine, against the virus, then that's the only way for this pandemic to end. And this is how we've seen it in the previous pandemics. And when a majority of the population is vaccinated and is able to, kill the virus in their bodies much faster, they can spread. The rate of them spreading the virus is much less. Then the virus doesn't have the chance to reproduce a lot. The virus doesn't have a chance to mutate a lot. So that's why vaccination is really, really, really important.
Okay. I have another question. Can I?
Moderator?
Sure, go ahead. Go ahead.
Now, My other question is that all those people, or like me, seniors, you know, do we still get a booster dose since we got the two vaccines of the Pfizer? And what is the period that we have to wait? Because I got it in July. That's the second dose. So I have to wait for maybe by January. Is it the time? I think by that time it will be 6 months. So is it a good time of waiting period to get the booster dose, or if it is really necessary to get that?
So
Thank you.
You're welcome. So booster dose will be necessary. Okay. Again, right now the government is focusing on those who are going to be much more vulnerable. So that's why they focus on those who are immunocompromised. They focus on those who are long-term care residents, because usually they are the ones who are more sick. So basically, these are the ones who should be getting the booster shot first, because they're the ones who are most vulnerable. Eventually, through time, the government will start opening the booster, the third dose, to the general population. The question when, it's through the government analyzing the situation in our province. That's going to influence them to make that decision. Like, for example, in terms of the interval, right? In the beginning, we had 16 weeks, and then they reduced it to 8 weeks. And then when we started hearing the Delta variant, it was a concern. So then they reduced the interval to 4 weeks, because they want the majority of the people to be able to have 2 doses, because 2 doses will protect you better compared to 1 dose against Delta variant. So it's really very situational based. And we're still doing very well here in Quebec. We have a very high vaccination rate. And again, if you're healthy, even after 6 months, you're very, very well protected. So the question when, we don't know, but definitely the time will come where we will get the booster shot.
Yeah.
And,
Look, I asked that because, like me, I have an asthma, and before this pandemic arrived, I was taking the prednisone twice. So that's why I'm really aware, and I'm afraid of this COVID-19. That's why I asked that.
I see. So I think it's important, Tita, to speak to your doctor to see if of the risk that you have because of your asthma and because of the prednisone that you're taking, because it's a steroid, and steroids usually can decrease your immune system. So I think what the best way would be is to speak to your doctor, and he will determine if it's the best when is the best time for you to get the booster shot. And this is in line with the government's decisions as well, because again, they would focus on those who are the most vulnerable for now.
Thank you.
You're welcome.
Thank you. Yeah. Another question. Nobody's asking, so I will ask.
Sure, go ahead.
How come those people who got already the 2 doses of vaccine, they still got the COVID? What's the reason? Maybe their immune system is low, or there's another factor that's determining why they get this?
So if we look back at the vaccine efficacy, it's not 100%, right? So this means that you have a good protection against COVID-19, but you're not 100% immune from it. So meaning that you can still catch it. The benefit of the vaccine is when you get the disease, you won't get as sick, and you won't die or get the complications from it, because your body is already trained how to fight the vaccine. And so your body has a better chance of surviving against the vaccine. And now with the Delta variant, it's a stronger variant compared to the original strains of COVID. And so now we're seeing that even fully vaccinated people can even spread it to others. Because before, with the previous variants, once you're fully vaccinated, the chances of you spreading it to others are very minimal. But now, with the Delta variant, that chance is a little bit more higher. So that's why we need to continue following the measures to protect ourselves and to protect others.
I asked that because you remember 2 weeks ago, there's a senator that died of this COVID, and she got the two injections already. You remember, there's a senator, and she's young. She's only 56 years old. And
I haven't. Sorry, Tita. I haven't. I'm not aware of that news. But
yeah,
we have to take these cases individually, because she might be having a lot of comorbidities, so other sickness in her body, him or her, that might have influenced how the disease progressed in her body. We don't know if she has a weak immune system, for example. But these like individual cases does not necessarily represent what's going to happen to the majority of the population. So when we hear news like this, we have to take them by a grain of salt and not think that what's happening to one person is going to happen to everyone. Because if that's the case, then for sure the researchers will find this, and then will report it to the public health authorities, and then they will start making strategies on how to stop it. But definitely, if it's something that's a concern for the majority of the population, then they will do something about it.
Yeah. Okay, thank you.
Thank you, Tita Cora, for your questions. And our president has a question as well, but before that, I'm gonna address the question here from the chat box. So it's still from like talking about booster shots, but address more towards the healthcare worker. So the question is, in Vancouver, they are giving third dose to healthcare workers. Is it going to happen in Montreal too? And do you recommend as nurses to have third dose? Thank you.
Yes. So the same answer as earlier. We will definitely get it because healthcare workers were exposed. Our exposure is much higher because sick people come to our hospitals and we take care of them. So definitely we will eventually get the third dose. Now, again, in terms of when, it's going to be based on studies and the decision of the government and the public health authorities. If I recommend nurses to have third dose, definitely. Whenever the time comes, everyone should be getting the third dose because, again, the purpose of this is to help increase our antibody levels. Because if you look at the other vaccines, some vaccines do require booster shots. So it's like when you get the booster shot, it reminds your body of the disease and it provokes it to create more antibodies. So it's like preparing your body for when the real disease comes, then you're going to be much better equipped to do it. And especially for us nurses who are have high exposure to COVID-19, and definitely it's good to protect yourselves, but also by protecting yourselves, you're protecting others because you're limiting the chances of you getting sick and spreading that sickness to the patients who are very vulnerable.
Thank you for that. And Ate Grace, do you have any questions for Mr. Magtibay?
Hi, Jan.
Thank you for having us. Okay, my question. I remember from the government says when a patient got positive, you don't need two dose, right? Two dose of COVID vaccine because your body was immune to the COVID. What will you recommend? Because I still see patients who had positive COVID-19 got a dose, got two doses. Is that recommended?
So in Quebec and in many other countries around the world, they're doing this strategy where if you've had COVID, you really only need one dose to be able to protect yourselves, right? To have that level of antibody that is enough to protect yourself from COVID-19. And many, many more studies are now showing that the second dose for people who've had COVID-19 already doesn't have a lot of impact in terms of building the immune system. Now, the reason why here in Quebec, for those who've had COVID-19, we're giving them the option to have two doses is because around the world, not everyone is doing that strategy. So in some places where they would require two doses, then that person who's only had one dose, if they go to that place, they would be considered not fully vaccinated. You know what I mean? So that's why they gave them that option to be able to have those two doses. Now, of course, they've had to look into like the safety of it, and they've considered that even though they've had the vaccine and they got two doses, it won't cause harms to them or it won't cause them to have more side effects. But really, it's an administration issue. That's why they were able to get two doses. But scientifically, they only need one dose at this time. And then, of course, it's going to be a different answer for when we're going to be talking about booster shots.
Speaking of booster shot, the same thing. You know, this COVID-19 is very sensitive to me because of the issue in my family. So one of member of my family in the Philippines got two COVID-19, got a Delta variant, and now he received a booster. Is that right? How many months? How many months? Usually here, I remember for my patient, at least from the COVID positive, you got a vaccine after 6 months.
So can you repeat that last thing that you said?
Usually when a patient got positive, COVID positive, they receive the vaccine after 6 months.
So I'm not well aware of the current recommendations now in Quebec, but when I was working in the COVID vaccination clinic, those who were positive with COVID, minimally they can get the vaccine 21 days after they were positive, or 3 months, because they say that if you get the vaccine too close to when you had the disease or when you were infected, then you might have more reactions to the vaccine because it's still fresh in your system. But in terms of your family member who's had two vaccines,
Delta
positive,
and then now booster.
And now the booster. So now really, I think the only concern with that is his body's reaction with the booster shot after the illness. But overall, I would think that might be beneficial in the long run, because now he's considered of having like four exposures to the antigen. So his body, the only positive thing is his body would just create more antibodies for it. And in the Philippines, I know there's many different vaccines that are being offered.
Yeah.
And from what I've read about it, is really the efficacy is much less compared to if you're getting an mRNA type, so like a Pfizer or Moderna. So the chances of you getting COVID is much higher if you received other vaccines from other parts of the world.
Okay, good. Because his booster now is Moderna, so I think it's more in a positive way.
Mm-hmm. So
Thank you
it's
so
only
much.
going to give him, better chances.
Yeah. Thank you so much.
You're welcome.
Ariana? Ariana, we can't hear you.
Sorry. Any more questions from our participants? And I have a question myself, though.
Hi.
Oh, sorry. I forgot about it. Yeah, Rachel Altar, please address her question.
Hi, John. I would like to thank you for the very informative presentation. But I have a question with regards to, is there any new research regarding the role of the blood type and how it regarding the role the blood type plays in how easily a person can be infected by the coronavirus and how bad the infection will be?
I haven't heard honestly about the link between blood types and diseases, because even if you look at the other diseases than COVID-19, well, in my experience at least, I haven't heard that someone who's type B gets more sick than those who have blood type A. I don't know if this is something new in regards to COVID-19, but personally, I haven't heard this.
Oh, okay. I just raised that one because I have read some articles that tackles about it, and so I'm just wondering if there's any new research about that. But thank you so much.
I'll look into it. It's definitely something interesting.
Yeah.
With COVID, there's a lot of things that are still unknown, and because of how it's progressing, there are many more possibilities that may happen. So definitely, I'm not closing my mind for that to be happening, but it's just that it's not something that I've heard of the current readings that I've been doing.
Okay, thank you so much, Mr. John.
Thank you, Miss Altar, for that. My question, Sir John, is because I think the main challenge for us nurses is in terms of educating people about the information, like weighing what's the accurate information regarding COVID-19 and vaccinations. So I'm just wondering, like in a nurse educator perspective, like do you have advices or suggestions that you can recommend to us nurses on like how to, first of all, make these people listen to us, and like how to educate them, like just debunking these myths or misconceptions, for example?
You raise a very good question. I actually had to attend a little training on this regarding motivational interviewing. So in terms of successfully convincing someone to have the vaccine has a lot of factors. First, if it's someone that has that's totally closed-minded about it, whatever you do or whatever you say, it's not going to change their mind. It's the people who are having hesitations or doubts or questions where you would have a higher chance of where you would have a higher chance of convincing them or teaching them. Now, when we approach people, first we have to cater which information we want to give them individually, because you can't apply the same strategy for everyone. And not everyone would have the same questions or the same concerns. So it's very important to in a non-judgmental, open way, like look into them and ask them what their concerns are. And because maybe, for example, maybe they're worried about like one issue and not really the other issue. But if you're giving them information about the other issue, then it's not really helping them in making that decision. But you really have to individualize your strategy and ask them, what they're worried about, and validate those worries, because again, not everyone thinks the same way, not everyone has the same worries, and so you have to tailor your strategy to each different person. But of course, in terms of attitude to everyone, it should be non-judgmental, and just having an open listening attitude.
Thank you for that. And sorry, any more questions from our participants?
Just a follow-up question, John. Now that the government is like starting to give vaccines for the children, and many of my coworkers who are mothers are hesitant to do it, what will be your advice to all the parents who will be watching this awareness program?
So I think the same thing. Like, what are your concerns, right? Because it's easy for us to. I'm a parent myself. I have a 2-year-old. It's very easy. Well, of course, we want the best for our children, and we want to protect them against harm, right? So the concerns, whatever concerns that you have, go get that information. Ask someone about it. If there's something that's worrying you about the side effects, then look into it. Ask a healthcare professional. And this is where getting information from trusted sources or credible sources comes in, because if you're getting the right information, then it's going to influence you to make a better decision, right? So with the current research that we have now, we know that for those who are 5 to 11, the vaccine efficacy is 91%. The side effects are minimal, and then they haven't seen any rare or any severe reactions from this population. So definitely, it's considered safe enough to this age group. And as parents, you also have to weigh your pros and cons. You should have a risk assessment. Especially my daughter who goes to daycare, she's exposed to viruses like every week. Like, our family has been sick on and off for the past 2 months, I would say. So she would catch something, we would get her tested, it's negative, she'll get better, and then a week or 2 weeks later, it's the same thing again. So, we know that our children is exposed. What would we want? Would we want to risk them getting COVID-19 unprotected and not knowing how their body will react from it, right? Because they might develop some severe complications from it, or have the vaccine where it would train their body to fight the virus. So when they do get exposed from it, they won't be as sick. They might not get hospitalized. Basically, giving them the better, a better chance to surviving this virus. So definitely, if you have someone 5 to 11, please get them vaccinated. But of course, whatever worries or concerns you have them addressed. Don't wait.
Yeah, thank you for that advice, John. And before we close, is there any other questions?
Any more questions from the virtual participants?
Yeah, I have another question. Okay. My question is this. Do you think it's that's why the people or the population doesn't, not all, but maybe half of the population doesn't believe on these vaccinations because of the media and all this Facebook and what they see? Because I think they listen more on that particular for the media and the television than the doctors or the nurses or those health workers who are delivering a good about these vaccinations, a good perceptions, but they listen more on this media that blah blah blah, all this not really the good intentions of doing to get all this population to be vaccinated, so that we will stop this COVID, this this infection. That's what my mind is. I'm thinking of that, because this is the people are always looking on the Facebook, on the TV, listening to this. That's why I think they are more persuaded with that.
You raise a very good point and question, Tita. And this shows how the responsibility of the government, of the scientists, and even for healthcare professionals to make this information more accessible and easier to understand, because you won't expect a regular person to be reading a scientific paper. It's going to be like a foreign language, right? So that's why for us in the medical field, in the healthcare field, we should have a responsibility to help others understand about COVID, about the vaccines, it better, to make it easier for them. And I like how you were pointing out like Facebook, because a lot of the people are on Facebook and they get information from that easily. But it's for them to be reminded that whatever information that you get, you have to make sure that it's a trusted information. Because as I gave an example earlier in the pandemic, especially in the Filipino community, you would get a lot of shared posts, or someone who will drop a message on your messenger about like, hey, you don't need vaccines or whatnot. Just exercise and just drink some, eat a lot of vegetables, and that's going to be enough. But
Exceptions.
we know that that's not the case. So it's really information, like knowledge is power. So knowing the right information will help you make better decisions. So yeah, thank you, Tita.
Thank you. You're welcome.
Thank you for that. And any more questions, participants? I guess that's a signal for no more questions. So once again, thank you so much to our guest speaker, Mr. John Aldrin Magtibay. This talk is really interesting, because foremost, it's very timely, because we're in a current pandemic situation, and also like as what the questions about in the open forum address, like there are some queries or misinformations sorry, in their minds about COVID-19, in the general public, that needs to be addressed as well. So I guess this presentation of yours gave for us, like here, participants, to address those queries and clarify those misinformations. So as Steve said, like knowledge is power, I believe our participants now are more powerful to be sort of educators, not only to their colleagues, to their loved ones, but also to the public in general. Thank you so much for your talk today.
And thank you for inviting me and giving me this opportunity.
Thank you.